So with all the new drugs that are now available, I and most of the hematologists in Australia do still feel that a transplant is necessary, particularly in the Australian context. The Medical and Scientific Advisory Group of Myeloma Australia produces guidelines on a regular basis, and the guidelines still do recommend that we perform a transplant in fit and eligible patients. Now, globally, there is emerging evidence, though, that in a subgroup of patients with standard risk myeloma, so patients who don't have any adverse risk factors, they may be able to get by without a transplant, but only if they have access to prolonged treatment. And we often don't have access to that in Australia. So as far as possible, in young and fit patients, we do recommend that transplant be administered to try and deepen the response as much as possible. However, if patients are older, they can certainly get by without a transplant, and we can treat them quite effectively with prolonged doses of anti-myeloma therapy.